Hello, everybody. Welcome to our debate about the highly important issue of recoupling societal wealth and individual health from efficiency to resilience. Thank you very much for joining us. You are invited to participate in our debate as well using the Q&A tool if you would like to. My name is Astrid Frohloff. I'm a German TV moderator and journalist, and I have the pleasure to lead the discussion. So what makes this session quite unique is the fact that it's initiated by the heads of two highly important organizations, the Global Solutions Initiative Foundation, as well as the World Health Summit. And we have the pleasure to welcome today the presidents of both organizations. Dennis Snower is with us, president and founder of the Global Solutions Initiative, one of the most known economists in Germany, and many years he served, as you may know, as the president of the Kiel Institute for the World Economy. Hello, Dennis, how are you? Detlef Ganten is joining us as well, the president of the World Health Summit, a specialist in pharmacology and molecular medicine, and one of the leading scientists in the field of hypertension. And both of you are the chairs of this session. Great to have you with us. Let me introduce our other distinguished speakers. Agnes Sukat is joining us, Director for Health Systems, Governance and Financing of the WHO. Francesca Colombo, Head of Health Division, OECD. Dana Borisek, Senior Economist, Macroeconomics, Trade and Investment Global Practice of the World Bank. And Benoit Miribel is joining us, Chairman of the French Foundation Center is joining us. Great to have you all here. So let me give a little remark of what we're going to talk about today. Our world is facing great challenges. One of it is COVID-19 pandemic. And the question is, what political approaches are necessary to encounter these problems? It seems there is a misunderstanding of what constitutes human well-being. Currently, policy measures and business decisions are focusing mainly on growth and GDP. But the well-being of society not only depends on material gain, but also on the goods of health system, social solidarity, access to education, social participation, and a healthy environment. In order to solve global problems such as COVID-19, the question is, how can we come to a different approach, which is focusing mainly on the human well-being? So focusing on the G20 as the largest economies and some of the world's wealthiest countries, this panel will ask for ways how to recouple health and wealth as part of a more human-centered development mode. So I would like to hand over the mic now, first of all, to Dennis Snower, who proposes a new measurement for well-being beyond GDP. So Dennis, the virtual floor is yours.
Thank you very much indeed. And I'm absolutely delighted to be in this group of august and important speakers. I just want to spend a few minutes introducing some central themes of this session. Basically, the problem that the entire world faces is that our understanding of how to deal with the current pandemic is divided into silos. And these silos are seen as in conflict with one another. For example, opening up the economy and doing things for people's material well-being is seen as in conflict often with health policy, which is associated with shutting the economy down. The pandemic has exacerbated inequalities that existed beforehand, and therefore society has become more fragmented. And that is seen as a totally separate problem of social policy. And this is deeply, deeply problematic because these different silos accord with different ministries and different voices within government and policy-making institutions. And the most natural thing in the world would be to step back and take a more holistic approach to the entire problem, which is that we are all here to help enhance human well-being, seen broadly across the entire spectrum of things that make life meaningful, worthwhile, and enable individuals to be fulfilled and happy within thriving societies. Now, to do this takes a broader approach than simply health policy, economic policy, social policy, and environmental policy. And in order to take this holistic approach, I would just like to point to two important insights that could help this discussion enormously. The first extremely important insight that has certainly changed my entire thinking about the problem is Detlef Ganten's Gesundheitsformel, his health formula, which says that health is a function of biology, what goes on in our bodies, and in biological terms more broadly. It's a function of the environment in which we live, and it's a function of behavior. And understanding this deeply helps us steer a more effective and fulfilling course through the pandemic. Because biology means that we should really focus on health rather than illness. We shouldn't just try to cure people who have fallen ill. We should devote as much effort to prevention. We should see the pandemic as something that cannot be overcome anywhere unless it's overcome everywhere. And therefore, we need international cooperation that is organized on a global scale. And we need institutions that help push this, not only at the supranational and national level, but also all the way down to the regional and local levels, so that every person feels empowered to do their part, and the higher level institutions are seen as legitimate. And that is all really important for understanding how we are meant to deal with our health in terms of biology. In terms of environment, our social, political, economic, and environmental environment is terribly important, and structuring it in such a way that we can promote the goal of well-being more broadly conceived has huge implications. Take the economic environment. Simply to focus on opening the economy up or shutting it down really seems foolhardy, because there are many opportunities for governments to support struggling businesses, to support workers who are currently unemployed, to find either new work or reconstructed work that is compatible with social distancing, all the preventive measures that you need to keep the pandemic from spreading. If the more than $5 trillion that have been spent on economic measures to help people without jobs and to help businesses that are failing would be devoted to adjustment in a socially responsible and health conscious way, we would be well on the way towards a new normal, which currently we are not, because many policies have focused on job retention and giving subsidies to businesses that are failing, and thereby ossifying the status quo. So looking at the environment that we need to operate in order for health and economic policy and social policy to become complementary to one another rather than pulling in opposite directions is terribly important. And then the last element of the Gesundheitsformel concerns behavior. And human behavior rests not only on one's individual preferences, but also on social norms and values and the identities that we have. And to engender norms that will induce people to cooperate across national and cultural borders when we have a global problem like the pandemic is terribly important. And it would be terribly important for those who can shape these norms, the politicians, the thought leaders, to expressly make their contribution in this direction, rather than focusing on nationalisms, a me first policy that goes in exactly the opposite direction. And the last thought I'd like to leave you with is a recoupling dashboard that a colleague of mine and myself have developed, called SAGE, SAGE, standing for Solidarity, Agency, Material Gain, and Environmental Sustainability. These are all different normative aspects of what make people fulfilled in their lives. Solidarity has to do with communitarianism being embedded in a social order, focus on the common good. There's been too much emphasis on individualism and not enough on the common good in fighting the pandemic. Agency deals with empowering people, giving everybody something to do to contribute to this common good. Quite often, policies have been handed down in a very arbitrary manner that leaves people feeling disempowered. That does not help in terms of compliance, which is so important. Material gain, that has to do with the economy and also the finance for our health systems. And there we've learned that efficiency should not be the only criterion, but resilience should be taken much more seriously in the future. And in terms of environmental sustainability, there's been a lot of work on how we need to readjust our interaction with the natural environment, not only with wild animals, but also with regard to the plant world, in order to make pandemics less frequent, allow more wild spaces, allow nature to become the natural ecosystem to start having a better chance at regulating itself. These aspects of the dashboard all fit very well into the Gesundheitsformel, and they together provide a broad set of criteria whereby a holistic approach to policy with regard to the pandemic can be evaluated and implemented. That's as far as I'd like to take it, and I'd like to hand back to you, Frau Vorlauf.
Thank you very much for sharing your views with us, Dennis. It's highly interesting, and I think we will use this as a great base for our debate now. You are invited as well to join the debate. If you would like to, you can use the Q&A tool and put questions. We're glad to receive them. I will pass them forward a bit later. So, Mr. Ganten, Detlef was referring to your book, Die Gesundheitsformel, the health formula. What is your perspective on this issue?
I must say, I always like to listen to Dennis. And it's amazing how an economist and a medical doctor, actually my training was in genetics, genomics of cardiovascular diseases, has nothing to do with economics. Now we are getting older and older, we are coming closer and closer. Isn't that nice? Dennis, you were talking, starting off with silos. If you look at medicine, and I'm sure, I hope you have not been in a hospital or somewhere, but even if you have a medical problem, you go to the general practitioner, you go to ear, nose, throat, and you have all the specialists. If you go to the Charité, you have to really know where to go because it's divided up in 50 specialties, okay? And the more sophisticated a hospital is, the more specialties you have. You know all that. and you suffer from it because the doctor, the modern doctor, doesn't look at you anymore. He looks at the laboratory values and looks at your ear or nose or throat, never ear, nose, throat at the same time. Okay, so that is one. The silos are there. The silos are also in health. If you look at health and some of the discussions here at the World Trade Summit, they are about economy, as Dennis mentioned, but it's about foreign policy, it's about migrants, it's about social systems, it's about military. So every ministry has economy anyhow, and every ministry has something to do. And they don't care, unfortunately, about health. They care about their budget. Even if I may say so, I hope nobody listens, the Ministry of Health doesn't really communicate as much as they should with the Ministry of Research and Technology, despite the fact that the Ministry of Research and Technology has much more money for medical research than the Ministry of Health in Germany. And similar things occur, of course, in many countries, you know, some other kind of divisions. Now, so I think these silos are the real problem. And I take my conclusion, you know, right in front. They are the problem because people are not ready, they're not prepared, they are not learning the vocabulary of their counterparts of the other silos, and they don't see that the world is complex, and if they want to understand the world, they have to learn to understand complexity. The future of the challenge of the future is understanding and coping with complexity. Now, of course, this is a tough job to do, and specialists are needed. And so what I did in my book, actually, it was emerging from my research work, as I guess it was from Dennis's as well, the SAGE system. I was looking at the cardiovascular system of man. And then I realized the cardiovascular system is a very old system. Every multicellular organism, the origin of life, of course, is one cell, okay, the archaebacteria. But then if several cells group together, they're multicellular organisms. Then the cells have to communicate. And if there are many cells, they have to communicate by a system. This may be the lymph system, but pretty soon, if there is more energy demand, there's a cardiovascular system. So it's a very old, evolutionary, very old system. It's more than 1 billion years old. And from there on, we developed the wonderful cardiovascular system we have in the brain, in the heart, and in all our organs. So, and this sophistication of systems in evolution occurs by the interaction of the biology. That is, if we stay with the cardiovascular system, I could tell you the same about the nervous system and the bone and muscle system and all the other gastrointestinal system, all the systemic entities of the body. Okay, and they originate evolutionary by an interaction of the biology with the environment. If a fish has no organ system to swim, he will not survive, and he will have no kids, and there will be no fish anymore, okay? And of course, by behavior, because the biology has to adapt by its behavior to the environment, okay? So if the three don't go together, there's no survival, there's no reproduction, there's no species. And Charles Darwin was astonished that there's so many different species on the Galapagos Islands and around the world. And he was the first, really, to discover these three components: biology, environment, and behavior. And this, of course, is in simple organisms exactly the same as it is in sophisticated people as participating here in this panel. This does not change. And if you look now at health and disease, you will realize that our biology is very old. All of you look very young. I guess I'm the oldest. So I'm already close to 65. from the up or down up, whatever, okay? Our biology is extremely old. The organ systems, cardiovascular, nervous system, bone and muscle, gastrointestinal system, they're about 1 billion years old, okay? And we are living, and they're actually, they changed a bit. The nervous system, the brain sometimes is lagging a little behind in some people, but in principle, the principles are still the same. And we are living in a completely new environment. You see behind me a high-rise building. You are living in comfortable houses, and the environment is man-made. We are living in the Anthropocene, and our biology is not adapted to modern life. We are not adapted to living in Shanghai or Mumbai or Sao Paulo or somewhere. In Oxford and in Berlin, I don't know where you come from, these are villages. Oxford is a village, Berlin is a village, and London is not really a village anymore, but they're real big cities. And in these big cities, life is completely artificial. If you are afraid, and if you know the evolutionary reaction to fear would be crying and shouting and running away. If you do that in the city and the traffic light is red, you're gone, okay? If you do it in the city and there's no traffic light, but there are other people around, and you do that twice, somebody will come and pick you up and send you to psychiatry. So they put you behind doors. So the biology is specific and old and an evolutionary product. The environment is artificial, and our behavior is kind of in between. What do we do? And many of the mental health diseases result from the fact that we are living in an environment which we cannot cope with, you know? And then some people think we are stupid. Some people think we are mad, but we are not. We are just natural. So this is my brief introduction, and happy to answer questions.
Thank you very much, Mr. Ganten, for your analysis. I would like to pass over to Agnes Sukat. What is the perspective of the WHO if we go back to the original question of how can we bridge health and wealth, and how can we come to a society which is more centered on the human well-being instead of GDP?
Thank you very much, and thanks to Dennis and Detlef for very inspiring thoughts. I mean, clearly, the World Health Organization has always been the multilateral organization that places health at the center of both societal development and economic development, and has always considered health, if you see it in the WHO definition, not as a lack of mortality or lack of disease, but as a state of societal well-being as well as biological well-being. And the World Health Organization has always throughout its history considered the importance of social determinants with the important work that has been done in this field by Sir Marmot together with the institution, as well as increasingly recognizing the role of the environment and being extremely active recently with our new manifesto, in the sense of really considering all the components of health within its ecological, of human health within the ecological environment, whether we talk about animal health, One Health, but beyond that, overall environmental health, including the relationship with biodiversity and generally the state of the environment, including the future relationship with the changes in climate. So planetary health, I would say here, the sort of interaction between health and the planet is very much in our mind. And the recent Lancet's commissions on the syndemic of the interaction between the environment and our food systems, and the role that modern industrial food systems play in health, in the sense of the growing part of non-communicable disease in the causes of poor health, and the link of that to the question of environment, the question of agriculture production, and the question of, for example, the ocean acidification and fish stocks. Also the question of meat consumption and the role of cattle raising in carbon emissions. So I think increasingly there is a recognition, not only within the WHO secretariat, but among WHO members, that we need to consider health within a much broader question that links health to not only the societal determinant, the question of equity, the question of how social contracts provide that access to health, but go beyond that. They help with cohesion of societies, with peace building, which in return contributes to societal welfare and economic growth. And actually, we do have some work done a few years ago about the economic returns of, for example, achieving universal health coverage, in which we see that there are some benefits on actual growth on top of the benefits in terms of addressing the determinants of multi determinants poverty, multifactorial poverty, and that overall placing health in the debate on the future wealth of nations, as well as the equity of societies and the relationship between the evolution of human societies within their own environment and the pressure that we pose as humans to the environment is very much into our mind. So, but what does it mean in practice? And here I really want to come back to one point that was made by Dennis on the question of common goods. Because if we place ourselves back to December 2019, just before the COVID-19 pandemic hit, we saw that we were on a quite good trajectory when it came to health indicators. We would see that coverage with essential health services was increasing worldwide, albeit not fast enough to reach the Sustainable Development Goals by 2030, but we could see that generally societies were making progress. We were benefiting from both technological progress, this social cohesion that universal health coverage, social contracts bring to societies, and also, of course, the fact that the world has been becoming richer over the past decades, and that wealth was triggering health. But within that sort of positive outlook, we could already see the seeds of what is now very clear, which we had some blind spots. There has been a collective failure from the global community to understand that there were already the signs of things to come that were very concerning. And that includes this pandemic risk, which is linked also to the environmental potential broader environmental threats. And what we can see is, interestingly, and I'm very interested by what Detlef said on this, is that we have a problem globally of collective action. We have a typical economic problem of free rider when it comes to common goods. And clearly, rich countries, as much as poor countries, by the way, as much as the developing world, have underinvested in common goods. They have underinvested in public goods. We've seen it when we started thinking about the response to COVID. There's been a lack of investment in public health measures, a lack of investment in understanding the complexity of the relationship between health and wealth. We have underinvested in the understanding in the data and statistics world. It took us months, and even now we are struggling to develop mechanism to measure the impact of the COVID-19 pandemic in a way that is standardized globally. And we've seen that as much as globalization has been a globalization of markets and has brought some really important benefits in terms of wealth, countries getting richer, also poverty declining very rapidly. But this globalization of markets was not accompanied by a realization that we also need globalization of the question of common goods, and that global common goods require new institutions because we are now one world. In many ways, this pandemic is the first pandemic that touches every one person on the planet. So we are facing a global public good problem, particularly when it comes to climate change and pandemics such as of COVID-19, but we don't have the global institutions to fund those global public goods, but also more generally the global common goods, if we include not only public goods, but also the large global market failures that are not identified because we don't really have that collective action at global level. So if I'm trying to think about what could be done, we actually have a rich understanding of the question of common goods that comes from the experience of nation states and the experience of welfare states and the way modern states have tackled those issues over the past 100 and 150 years, because modern states are actually a very recent phenomena. But the good thing is over the past 20, 30 years, we increasingly have an understanding of what modern states can achieve, including universal health coverage, including high level of not only wealth, but also health, high levels of equities. But we don't really draw these lessons at global level. And we know that there are some underlying fundamentals for people to realize they need to invest in collective action and ask for common financing of common goods. And one of them is salience and realizing the problem, because usually a problem that is everybody's problem is nobody's problem. So that, I think, the pandemic is really an opportunity in this sense that everybody understands we do have common problems. So the salience issue here is an opportunity in the COVID-19 crisis. But we have two other issues, and they were mentioned. The second one is the question of identity. And we see it. We see how identity politics are revealed by the pandemic. And we know that when it comes to common goods, it requires collective action. So it requires building common identities. And if we talk about whether we talk about national goods or global goods, we need a common identity at national or global level. And the construction of those identities, particularly the identity as global citizens, is a very large challenge. And we see that politics may go the other way, in fact, in fragmenting identities rather than building that collective identity, which is the major risk to the future. If we don't manage to build a collective identity as global citizens, we will have difficulties in tackling the health problems of the future. And the last question when it comes to common goods is the question, of course, of special interest and vested interest. And we know here that goes very much into our discussion before, what kind of societies produce health and produce wealth. Again, we've learned a lot, but still, we are still learning. But the question of interest, of special interest of some groups, of interest of a few versus the interest of all, the question of integrating the poor in the social contract, the question of the alliances that can be made between middle class and the poor are very important. And that really brings us to the question, and I'll finish with that, of if this is the key question, the question of collective action, how do we trigger it? And particularly at global level, because when it comes to financing those global goods, that means finding a common source of revenue. So the question of a global tax. It means finding a collective arrangements to use those resources, and being able to pool our efforts into institutions that are transparent and accountable to people. And finally, it requires a much better understanding of what is it that we need to fund, and having the space of science that is actually sufficiently transparent and accountable to citizens, so that we again build the trust between the elite and people is going to be very important. So that's really in many ways the agenda of tomorrow, because in many ways, and I would totally agree with the diagnostic that was posed by the two previous speakers, is until this pandemic hit, we were really limited in our analysis to a historical analysis of what had worked before, a very narrow focus on disease, not on health, not a lack of recognition that the disease of tomorrow may be different from the disease of yesterday, and that we cannot only base the building of future health systems in a broad sense on what has happened before. We need to understand what will be the challenges of the future and really invest in the functions that are common good, the functions that will be able to respond to the problems of tomorrow. Thanks.
Thank you very much, Mrs. Sukat, for your insights and your interesting thoughts. I would like to get the view of the OECD now, Francesca Colombo. The OECD is measuring the human well-being by using the Better Life Index. What are the newest findings, and what do you think, how can we manage to recouple economic and social prosperity in regards to health systems?
Yeah, sure. I mean, obviously there is a lot of reflections, and some of these are thoughts which are a bit gloom about all the failures that we have. Just one thing perhaps to start and to give a little bit of good light. When the pandemic hit, at least in a number of European or OECD countries, there have been a very tremendous efforts to really protect people, and to protect people not just in terms of their health, but also in terms of the various social employment, temporary employment conditions, in terms of trying to make sure that their consumption could be maintained or not. And so I think we should not forget that there has been a very fast reactions, arguably late, but that this has been in the direction towards having really the well-being of society, which is maintained. So I think that's at least something which is positive to say. Now, the OECD has been put the agenda of well-being and the good life of people on the agenda for many years. And partly it's been also due to the recognition following the crisis, the financial crisis in 2008, that many things went wrong in terms of what we measure from society, how we judge the success beyond the GDP, and also how we should think about the interconnectedness between different systems. So there was a new emphasis which has been put on thinking about new approaches for economic challenges that really built on the interconnectedness between different parts of society. And so in the Better Life Index and all the agenda of well-being, the approach is really trying to look at different dimensions which have a bearing and an influence on people's life, whether they're of course related to the health of people, but also related to things like work-life balance, educations and skills of individuals, things like social connections, which are so fundamental as we see in context of more isolation and social isolation brought in by COVID-19, environmental quality, of course, personal security, the question of subjective well-being, and also governance and civic engagement. So quite a lot of different dimensions which are measured to see how progress is going. And by and large, we have seen that in a certain way there has been some progress. Cannot just be completely negative here over the years. Definitely, poverty at global level has been reducing, but also there has been also improvements in people well-being in many ways. Although there's been possibly deterioration in those dimensions which are measured in the well-being index, on things related, for example, to how people connect with each other and their governments, their trust also in governments. That has been an area where there's been not as much as progress. Now, what this crisis really brings to the fore is the importance of this interconnectedness, and how we know, of course, the health and well-being of individuals is not just the products of action in one individual sector, is the results of what happens in many, many different parts of society. And there are very complex interactions between all of those. So understanding those interconnections and how to try to make sure that we rebuild new collections is probably the biggest challenges moving forwards. Arguably, we could say that the crisis is a demonstration that many of the things have been failed in that perspective, that we still have systems which are highly disconnected between themselves. That, for example, even if make examples specific to health, there has been in the past major infectious crisis links to SARS, for example, and there were a lot of efforts to put on resources for developing a possible vaccine. But in the moment in which these infections, diseases, the pandemic vanished, all those efforts vanished as well. And if we could have had incentive systems or a focus of action until, to have really the outcomes, which would have been delivering a vaccine, we would have had a vaccine for SARS that maybe was not needed at the time, but it would have brought us in much better positions right now when we're faced with a new epidemic. And again, if we look at the interconnections, for example, between health and social care or long-term care system, at the very beginning of the crisis, lots of attention has been put into the intensive care units and into the hospital systems. But not only much later, there's been attention put onto the long-term care sectors, the nursing home, and there's been a collective failure in seeing, a pandemic that disproportionately affects the elderly, and seeing that would require obviously actions in terms of infections control and so forth in the long-term care sector, possibly due to these disconnections between different systems. So I think for me, there is an opportunity here, as much as there have been, and there is a very, very strong efforts to address the current crisis, huge mobilizations of resources, including at the European level, but also globally. So I think there is an opportunity to build back systems which are better, which are much more interconnected, a more analytical understanding also of some of those interconnectedness, think about also supply chain systems and how they are deeply interconnected. You know, what system do we need into the future for supply chain to avoid similar situations to what we are seeing right now? I think there is a window of opportunity. You know, sadly, of course, certain things should have been done afterwards, but I have the hope that with all the investments, even in intellectual thinking, we will be able to come up with systems which are stronger into the future, not just health systems, but more broadly societal and economic systems which are stronger. Provided, of course, we have this focus beyond single sectors and onto more global well-being considerations. We have the tools.
Thank you very much, Francesca, for outlining your view. Let's see if Dana Voracek is still online and if she can be the next one who speaks. Maybe the line is not, oh yeah, she is.
Of course, yes. Sorry, I
No problem.
turned myself off for one moment.
Yeah.
So I work for the World Bank, as you know. The World Bank has long been very concerned with measuring income poverty, right? As well as many other things. But just to review the expectations on what has been the impact of the pandemic on poverty, after a continuous decline at the global level in extreme poverty over the past 2 to 3 decades, we're now expecting an increase this year of roughly 100 million people. So 88 to 115 million people will enter or re-enter extreme poverty this year. So that's below $1.90 per day. So measured at higher poverty lines of 3.2 or $5.5 per day, the numbers will be, of course, much higher. So these are a function, of course, of job losses and to some extent rising food prices in some countries, but also to longer term changes, climate change and conflict, and the rising challenges of these things to people in poverty. These climate change and conflict tend to impact people who are close to or under the poverty lines more than people at higher levels of income. So as I mentioned, we've also seen from the pandemic a sharp decrease in employment in some places, and also severe challenges related to informality. For instance, this is in many emerging markets, a large share of the population works informally. So that has complications for policy making at this point. Also, these people are harder to reach through formal programs. They tended to enter the pandemic in a much worse position. Informal workers have on average about 20% lower incomes than formal workers, and quite limited savings to fall back on. So in a situation, I cover Latin America within my group. You have seen very stringent policy actions in all of the major economies, yet still very pronounced rise of the pandemic, right, of cases, COVID cases. So there are varying arguments around why we have seen this sort of divergence, but one of the arguments is that the informal sector, informal workers, because they're already sort of living on the edge, must continue to work through this. So they have been forced out of their homes to continue to work, and that may have contributed to a rise in cases, right? One other thing the World Bank is quite concerned about is the long-term impacts of the pandemic economically. I don't know, maybe I'll save that for a little bit later. But then just to turn back a bit to the poverty numbers, one thing the bank has done in recent years, in 2018, it launched not just an income measure of poverty, but what is called a multi-dimensional poverty measure. So this includes not only per capita income, but also access to and attainment in education, and also access to drinking water, sanitation, electricity. So while these are not explicitly health indicators, access to sanitation, of course, is or electricity, even or drinking water, is strongly correlated to the health of a population. If you have only 10% of the population with access to a proper toilet, you can understand very easily how this has long-term creates long-term challenges for the health of the population. I'll leave it at that.
Okay, thank you very much, Mrs. Borisek. At that point, we will continue to discuss about this, I think. But first of all, maybe we have a look at the perspective of the civil society, Benoit Miribel. What needs to be done to move us beyond GDP and towards a more human well-being focused approach?
Thank you, Astrid. A lot has to be managed, as we know. And as Denise and Detlev mentioned at the beginning of our discussion, we know that we need a verticality because we need the expertise of many experts in nutrition, in medicines, in social environments, but we need more horizontal approach. And this is why, as a new contribution of the civil society, during the confinement in France, we were discussing between foundations. And as you know, all foundations, they have their strategy, they have their priorities, they have their budget, and they are focusing because this is the way we work. And when we see all of us with a mask on the face, we realize how it's very important to have a kind of cross-sectoral action, especially because we have one health. There is only one health, no border between the both medicines, the animal medicines and the human medicines, no border at all. As you know, 75% of the infections comes from the animals for us, for human, and also with environment. So we decided to create a new foundation, a horizontal foundation, because of course we see a lot of foundation which is very necessary, very important, which invest in climate change or biodiversity, or other foundations investing in health. It could be biology, and all is very, very, very important. But we were discussing and thinking that we needed also a horizontal foundation. So the name of that foundation is One Sustainable Health for All. The word sustainable refers to SDGs because we would like to contribute together. So of course, intellectually speaking, we agree. But when most of the people agree, because we know that we have only one health, but then how to act concretely. And we have to have discussion among the French Foundation and also with Detlev Ganten about the World Health Summit and the perspective of this One Health priorities. And we decided to launch a kind of initiative for 2 years in order to have a working group, international working group, starting from France, Germany, Europe, Health Europe, somehow, and then to expand to more widely, internationally speaking. So it's as you know, when you have a foundation in many countries, and especially in France, it is because the state recognize that they need private initiative also to contribute to the general interest, because there is so much to do. So we consider that in the world of the foundations, we need to, of course, I agree that we don't need a silo and we have too many silos, but we need also verticality in a sense of expertise in many disciplines. But in addition to this vertical expertise, we need horizontal approach. And this is the purpose of this initiative, One Sustainable Health. And according to what we were discussing right now, it reminds me, you know, the reports that the report was in the Lancet a few years ago. It was the Oslo Commission, you know, this Oslo Commission about, you know, the governance, and they were in favor of having a multi-stakeholder platform on governance for health. And we must no longer see health only as a technical biomedical issue, but acknowledge the need for global cross-sectoral action and justice in our efforts to address health inequity. So the purpose of this initiative, starting from French Foundation, but soon we hope to have also the German and Europe Foundation and other, of course, NGOs, it's very ambitious, by the way, because it's not easy, but to have all the stakeholders together, including the business, of course, the government. So trying to organize working group. But during the first 6 months, we will start by looking to what exists in One Health. So we have an expert committee, specialists in many disciplines, urbanization. We need also for AMR, because we have many challenges, as we know, with resistances, and to take into account this One Health. And then in May, in France, in Lyon, we hope to have, we will see, it could be a virtual event, or if we can welcome you, we're very happy, in partnership with the World Health Summit, in order for 2 years, to have a commitment of the civil society with the specialists. And for the moment, we started with some experts. Of course, we have WHO and others. But it's just an example, answering to your question, Astrid. But this is from the civil society, from the French Foundation. And again, tomorrow morning at the French Embassy in Berlin, it will be virtual, but we will sign an agreement with the World Health Summit with this initiative, One Sustainable Health, in order to make sure that international NGO coming from the field, foundations, governments, businesses, we can all work together. But we have in mind that for the moment, we all are focusing in our priorities with the budget, and everybody has his own assessment. The annual assessment, it's about what I have to do with regards to my university, NGO, or business. And we need also to have the leader who give time to the people in their team and say, look horizontally, because we have One Health. So what we can do in addition. And I think that where we can get and make more progress in the future will be in additioning our capacity, breaking the walls and working together. It's easy to say, and as children we say, why don't you do it right now? And you know why it's difficult, because for many reasons. But we can save energy and gain by mutualization of the capacity. And of course, there will be a lot of debate also for health, if either we are in favor of solidarity, tackling inequity or not, or all this kind of consideration. I will not develop too much, but it was just to explain that we are very interesting to develop this new initiative in partnership with the World Health Summit and also with the Geneva Global Health Forum. So we will see in the coming years the progress we will be able to do. Thank you.
Thank you very much for your contribution, Benoit Miribel. I would suggest, Dennis Knorr, that we try to dive a bit deeper. If we look at the resilience in different countries worldwide in regard to the pandemic, are there any best practices for governments to make their health systems more resilient, stronger, healthier, and to recouple health and wealth? We cannot hear you, sorry.
There are several different levels of which this question can be answered. I will leave the practical level in terms of what have different countries done and who's been successful with what, perhaps to Francesca, but I can add to it later on. But at present, I'd like to focus on the introduction that Detlef gave to this, which is we as organisms, as species, have survived because of the interaction between our biology and our environment and our behavior. And we have created environments for which our biology has not been designed. And now, what does this mean in terms of tackling the pandemic, in terms of how we can interact with one another? Because in evolution, one thing that makes human beings reasonably unique among other animals is that we're able to think ahead, whereas evolution is a very short-sighted process. And therefore, the question of biological evolution needs to be seen alongside the management of our cultural evolution. What is it that enables people to manage the commons appropriately? And there's been a lot of work on this. In fact, one economics Nobel Prize has gone to this, to Elinor Ostrom, said that organizations, countries, groups that have managed the commons well have certain things in common. And we should take this seriously into account when thinking about applying Detlef Ganten's Gesundheitsformel to the pandemic. What we need, first of all, to manage the commons is a strong shared identity and purpose, which exists in small groups. Then there should be an equitable contribution of equitable distribution of contributions and benefits to the group. Fair and inclusive decision-making within the group, so that it's not experts who tell us what to do, but we all feel empowered to contribute to the decisions by which we are bound. Then there is very important monitoring of agreed behaviors, graduated responding to helpful and unhelpful behavior, like graduated sanctions, fair and fast conflict resolution, and then the authority to self-govern. That is, the self-governance should be agreed to, respected by outsiders, and then collaboration across groups, which again then need a shared identity and purpose and equitable distribution and so on. Now, if we apply this to the pandemic, we can see where our failings are. In many Eastern countries, there has been a monitoring of agreed behaviors. There's been a high level of trust, but also in compliance, but as well, a monitoring that has not been voluntary. In the West, monitoring has largely been voluntary. And consequently, a graduated responding to helpful and unhelpful behaviors is virtually impossible. Fair and fast conflict resolution is also absent. If we thought of what it implies to build institutions that, first of all, enable a strong sense of identity to be brought to bear on this, make sure that our contributions and benefits are equitably distributed across people, and so on and so forth, then we would have a totally different approach to dealing with the pandemic. I mean, take monitoring alone. The fact that so many countries have decided that monitoring should be optional, should be voluntary, is something that we do not follow when we check the speed of cars on the motorway. If you're over the speed limit, you're not asked, do you voluntarily agree that your speed be checked? When our taxes have to be filed, we are not asked, do you voluntarily contribute to this? You must contribute for the common good. In a pandemic, there is something similar. But in order for people not to feel disempowered, they need to be involved in the decision-making by which they are bound. And bringing that to bear, and also bringing to bear this understanding that different groups, as Benoit has said, horizontally and vertically, and also across countries, must cooperate in fighting the pandemic, then we have a chance, I think, to bring our economic prosperity into line with our social prosperity. And just a last comment, I believe that economics has done huge damage to our ability to cope with the crisis, because one of the most influential insights from economics is Adam Smith's invisible hand, at least economists' interpretation of it, whereby decentralized decision-making gives rise to a socially desirable outcome when decentralized decision-making is purely selfish. Decentralized decision-making at a cell level means cancerous growths. Decentralized decision-making never reaches the socially appropriate outcome. And therefore, we should think about how to manage cultural evolution on a multi-level selection framework.
Okay, thank you very much, Dennis Snower. We received some questions, and one question is asking about our education system. Maybe Detlef Ganten, you can refer to this question. Andrew Farlow is saying, universities and education systems are siloed. The way we educate and train students to think about the world is siloed. If you do an economics degree, it socializes you to think in a particular way about the world, and mostly interdisciplinary work is discouraged due to medical training. So the question is, how must the whole education system change?
I fully agree. I think education is key to the future of our society. And in parentheses, I think in our country, it doesn't have the priority it should have, but in many other countries as well. And I give you a personal example. My son was a wonderful young guy protesting about everything and running around the world and traveling the world, and then became a lawyer. And now as a lawyer, I hope he doesn't listen. As a lawyer, he has been disciplined. He wears a jacket. He lives within the legal system, which is man-made in different countries differently, different laws in different countries. There's no real reason. I mean, there are some basic laws. So it's in schools, in kindergarten, in schools, and in universities and later on. I think the legal system is siloed, it's too narrow, and doesn't leave enough space for curiosity and freedom of thinking, choosing your own problems. There's some schools in various countries, the Waldorf school and Montessori and others who do differently, but they're not that highly regarded. They're kind of selective schools of specific parents. So yes, I think education, we have to work on that. And actually, education, education of man, evolutionary, is curiosity. Okay, curiosity is education, and encourage curiosity, and then take your own experiences. That's what babies do before they are put to kindergarten or somewhere else, unless they have very strict parents.
Thank you very much, Mr. Ganten. Well, I think this answered a little bit the question, but our main question actually is, how do we get there? How do we break the silos? How do we manage to think in a more horizontal way, as you said before? Mrs. Colombo, do you have, if we look at the pandemic, do you think we are drawing the right conclusions out of it? Wouldn't this be, a good historical moment to rethink our approaches towards a more human well-being oriented politic?
If this is the right moment, yes, of course, we are still in the middle of the pandemic. So drawing conclusions while we are still, even in managing an acute situation is never super easy, because you also know you have not seen the full, development of the pandemics and how it has affected in many different ways. So I think we should start thinking, but we need to be with a word of cautious that things are still going on. So even in terms of measurement and what you can see and understanding, really, it's incredibly difficult. That said, it's quite clear that there are some things that we need to seriously think about, and it's not that we didn't know them before. I mean, the first, I mentioned already, the issues of how do we measure success for society in terms of well-being, even success for the economic model. At OECD, we have a huge agenda on the inclusive growth. So how can we make sure that the growth trickles down also to all individuals? How can we address the inequalities which have been built over time across different socioeconomic groups? But even in health, how do we measure success? And we have a large agenda in trying to understand better the outcomes and the experiences of healthcare for example, for people. What are the things that matters to them? What measure do we have really of outcomes of health systems? Because until we just measure how much we spend and how many services we deliver or how many people die, clearly important, but not the only issues, then we have very little tools. So obviously, first, the measurement is a fundamental agenda. I think I mentioned already the issues of addressing the inequalities, and so who is left behind is fundamental. Coming out of this crisis, we will have much greater level of inequalities. The people who are suffering the most are those who have a confluence of disadvantage. We see also over generations, but also in the life course of an individual, that those who are disadvantaged because they come maybe for socioeconomic groups which are poorer, they have fewer opportunities in education, their education system, they have a less continuous labor market experience, less well-paid job, more spells of employment and unemployment. They build vulnerabilities in the health systems, and they end up later in life with accumulated disadvantage. And so until you break that, we must be doing much, much better on these issues. I think we need to focus a lot on issues around the political leadership, of course, but how to build trust and transparency is playing out to be such a fundamental issue in this pandemic. And some of the countries that have been quite successful, there are a handful of them, they had some circumstances which made it easier for them, including in some cases more geographical remote situations, or even a less dense populations, and also good income that allow them to put in place a mechanism to protect individuals' income. But they also had a tremendous leadership in terms of political leadership, in terms of building the trust of people, in terms of transparency in communications, also about the risk. I think that's a fundamental issue that needs to be built in and brought more attention. And lastly, obviously, what I mentioned before, this better understanding of the interconnections between different sectors of society, including through analytical tools. They can be economic analysis, they can be through modeling that can help you understand what's the consequences of a particular interventions on different parts of the economy and society. I think we must do much, much better from that, and not just in terms of saying there are complex interconnections, but really studying them in a more thorough way.
Thank you very much, Francesca Colombo. Benoit Miribel, what is your opinion about this? What impacts do you see if we are focusing more on health instead of wealth, and what needs to be implemented in order to reach this goal?
I think that if we give more support to communities, to the individuals for health, taking into account all the components, then the wealth of the society will be stronger. Because the more we are in good health, the more we work, we are, because we know the cost for the society of having people the diseases, and it could be also mental diseases, not only what kind of disease. I'm talking about the WHO concept of health. So I think yes, Agnès Souka mentioned metabiota. We discover years and years about the effect of nutrition on the health and etc. and environment and urbanizations and many things. So the more we will take into account our individual health for all the communities, for the people, the more I think we will have a stronger society. The fact also is that we know that we are most of the, a lot of drivers of the health are beyond the control of national governments. And this is why we need also international rules, commitments and governments, but civil society, of course. And we have seen in France, for example, and Jean-François Delfrécy, who is the chairman of the National Scientific Committee that referred to our president, says very rapidly that he needed a kind of democratic commitment, civil society commitment, because it's difficult, and we have a gap if we don't have the follow-up with the civil society and the communities, and then you have a gap widening between the press and political and the experts and the rest of the people. They don't understand. So yes, it was to answer your question, and I personally think that the more we focus on individuals, community with resilience, we take into account, the more the social will will be stronger. It's I think it's also a way to consider it.
Thank you very much for this answer. There are more questions in the Q&A. I would like to pass one to Dana Voracek. It's about recoupling health and wealth, overcoming silo policy. The question is, isn't there a risk that it would require us to make compromises on both ends, economic performances and health care, at least in the short and medium term? And isn't that the last thing we can afford during or in the aftermath of a global pandemic? What do you think about this?
Sorry, I think I missed the crux of your question about.
The main question is, isn't there a risk if we focus on health and wealth? Is there a risk that we have to compromise on both? On health and on wealth? How can we manage to find a good way to equally balance these values?
Sure, I suppose in the short term there are one way you can look at it is having trade-offs, right? If you impose very strong sorry, can you hear me?
Yes, we can hear you.
Okay. Very strong mobility restrictions on your population, you can expect that will have very strong impacts on incomes and jobs, right? At the same time, that is perceived as the cost of saving people's lives, right? But I think there are, that's a very sort of broad brushed, not take that can be not necessarily the case and can be different within individual countries. I think in the long term, the better countries can manage the health crisis now, the better they will be, 2 years to 3 years from now, right? In fact, in past epidemics, there's been some work showing that stronger lockdowns, mobility lockdowns during the Spanish flu actually impacted or resulted in stronger economic indicators after the pandemic.
Okay, fine. Thank you very much. Agnès Souka, would you like to answer this question as well? I mean, this is, I think, one of the main things to think about where to cut things and how to balance between innovation in health systems, investment in health systems, and wealth on the other side. How can we find a good way, a good compromise? What do you think?
Well, first, I think if anything, the COVID-19 pandemic shows that there was not enough investment in health for the sake of the economy. So I think if we were looking for an investment case, as is often language that is used for investing in the common health functions, we got it, right? As we're talking about 4 to 6% of loss of GDP. So we have here a clear case that maybe there's not as much trade-off as we could think. And that in fact, letting risks and threats being ignored and sort of putting our heads in the sand and just praying that just will continue to enjoy economic growth without paying attention to the clay feet of that growth might not be such a good idea. In many ways, it has been said that this pandemic is a wake-up call, because now we see the issue of not having invested in preparedness, but there are other blind spots in both national policies and global policies, and they have been highlighted. I would say they're going back to the two main arguments for collective action, for government intervention, and I really appreciate the reference to Hallström on that. There's the argument of common goods and the argument of equity, and on both sides we already had in 2019 signs that there were risks on the curve of development of the world. If we focus on the rich world, on the G20 countries, we could see already some countries experiencing a reversal of their health gains. That was the case in the United States, and we start seeing this in the UK. So it looks like this sort of idea that we will constantly enjoy progress, because the 20th century has been incredible in that respect. There's no question. The 20th century is an oddity in the human history in terms of the dramatic decline in child mortality, the rapid expansion of life expectancy, and at the onset of the 21st century, that expansion, so this expansion of this life expectancy, long life expectancy to the developing world. So this idea that in a way we would reach the end of history in the sense of human health. And then we discover that not quite, right? Is that there are threats looming, and there need to be much more attention to that. So when say, so what should we do moving onwards? I totally agree with Francesca to say that the jury is out there to say who succeeded and not succeeded in handling this pandemic. It's not over. And we see countries who did very well in phase one, did less well in the second phase, and vice versa. And the epidemic is still raging, and there's still a lot of uncertainty. And of course, there is the role of the potential effective vaccine and how vaccination will be handled, will work at global level, which is also right now a large level of uncertainty on the future of the pandemic. But what I can say, what we've learned already, and which I hear loud and clear from that panel, what we've already learned is that we need to give much more attention to the commons and to the commons for health at both national level, but also at global level. because there are more and more issues that cannot be handled by one country at a time. And this is where the question of collective identity and equity of distribution is fundamental, because at that time, you know, we just all have to open the newspaper. The question of a collective global identity is quite a challenge, because when there is pressure and there is economic pressure, identity politics may go the other way, and the question of societal trust becomes extremely fundamental if we want people to actually trigger that collective action. So I think investing in the commons is I would say, is really the step zero of what we need to do now, even when it comes to actually these efforts at vaccinating that we will all support within the next few months. Need that collective action. So that investment in the common goods. The other point, in my view, is exactly this question of equity. So beyond the common goods, which are equitable by definition because they work for all, there is really the question of equitable societies, because again, the evidence we have from the history of modern states is very inequitable societies are unstable. Okay. And so the question of redistribution, the question of progressive taxation needs to come to the forefront, and probably has not yet enough. And we've seen in many ways, again, this pandemic has brought to bear some lessons of modern states. We've seen that Keynesian policies have been validated globally. We see everywhere the stimulus is validated. So I think some really already lessons on the common goods, on the stimulus, on strengthening the social contract, and but in the future there is an agenda clearly of much better understanding health and its relationship with the overall ecosystem.
Thank you very much, Agnes Sukat. Mr. Ganton raised his hand as well. I think he would like to add something, right?
Brief.
Yeah.
Just a brief remark. Coming back to the beginning, and when Dennis started, you know, we are organized in silos. That's a reasonable organization if you pursue your own interest. If we want to avoid catastrophes like a pandemic where we are not prepared, we have to work on prevention. But prevention, by definition, is not in silos. Prevention is done in a holistic way because you don't know where it hits. You know, you have to prepare for a large range of activities. And this is, I think, a very good example on what needs to be done and why we have in our own interest to overcome this silo thinking and get this holistic view. Thank you.
Thank you, Mr. Ganton.
Over.
Well, in regard to the time, we still have 3 minutes left. Dennis Snower, would you like to kind of sum up things? What are you taking home from this discussion? What are our learnings today?
I think it would be taxing on our patience to summarize the main points that have been made. But I believe that a few things have really come to the fore. One is that we should think very carefully about what makes people survive under changing environments and adapt our systems to maximize our chances of survival. And in order to do so, we need something different from simply following efficiency and maximizing shareholder value, which our economics and our business and our policy has been pushing. It will mean focusing much more on resilience, on robustness of our solutions to an uncertain world. It will mean providing economic policy as well as business strategy with flexibility by design, so that we help people adapt rather than stop them from adapting by financing jobs that are gone and helping businesses only as long as they struggle. That we make more progress on transparency and accountability, and we seek a multi-level governance approach to global problems. That captures a number of different themes that have been here. And if I could sort of end with where Detlef Gunten began, which is with Darwin. I think we advance through selection, variation, and replication. And if we allowed for many different approaches to lots of variation in our approaches, but then keep the populations reasonably distinct so that we can see what the outcomes are. That means obviously travel restrictions and so on. And then select those approaches that look as if they're going well and replicate them, then we would do much better than many countries that are simply focused on themselves and their own political issues in getting through the pandemic. And I believe that approach, together with sort of a multi-level cultural selection approach, will help us in the future to bring our biology into closer contact with our environment and to adjust our behavior to both.
Thank you very much, Dennis, Nora, and thank you very much, all of you, for joining this very insightful and very forward-driven discussion. I enjoyed it very much. Thank you, ladies and gentlemen, for your attention and for sending us questions. I hope that we can bring things forward, and when we meet next year at the World Health Summit, that we are many steps further than today. So thank you very much. Goodbye. Have a nice evening, and auf Wiedersehen from Berlin.